All right, what's up, guys? This is Dr. Kyler off and back with Pro Academy. Today, we're going to be diving into Little League Elbow and really what this is, how does it develop, and really the strategies to kind of go forward to make sure that you're keeping your body healthy and all that kind of stuff. So let's dive into this little quick presentation. All right. So, what is Little League Elbow? A lot of times, you might have had somebody on your team, or you yourself have had it, or you're diagnosed from a physician, and they're like, "Hey, you've got Little League Elbow." And they're like, "Well, what does that mean?" Right. So, essentially, it's an overuse injury in youth baseball players. Now, the part of the elbow that actually gets injured is the growth plate, and every athlete's a little bit different on the age that this may happen to specifically, but typically we're going to see anywhere from 8 to 16ish years old, and that's primarily because the growth plate on the inside of part of the elbow, so right here, it's not fully closed, so it's still developing. You're still growing, and there's a lot of stress that's imparted to the elbow when you throw, and so that part of the growth plate can actually get irritated. And so the specific part of the elbow, like I've been mentioning, the inside part, it's called the medial epicondyle. And in our arm, just very basic anatomy. So you've got your humerus, which is the basic, like the big massive bone in your arm. On each side at your elbow, there's a bone right here on the inside and on the outside. Okay, that's part of your humerus. It's just at the bottom part of your elbow. But that inside part of the bone is called your medial epicondyle, and that is the area that is getting stressed during throwing. And eventually, if you're diagnosed, like I said, with little league elbow, that's where this is actually occurring at. So it is primarily with just repetitive throwing. Typically, athletes that will get this. It's you're playing all year round. You're not really taking time off from throwing, and not watching pitch counts or really listening to your body. A lot of times, people aren't doing any kind of like arm care or strength training to make sure that you're keeping your muscles strong to reduce the risk of this. And so, let me move my face out of the way for a second. But right here on this picture, this is the humerus, like I was talking about. This is the outside of the arm. This is the inside. So where this arrow is at, this right here, that line right there, that's the growth plate, and this is where we're talking about when it comes to little league elbow. So there's just irritation to the growth plate. A lot of times people will call it like a stress reaction to the bone. In severe cases, it can actually fracture, and athletes might actually have to have surgery for it. So this is something you definitely want to look out for. Make sure that you're taking the necessary steps to reduce the risk of this stuff happening and actual getting proper treatment. So, all right. Let me move my face back over here. All right, symptoms to look out for. Like I said, I kind of mentioned this just a little bit ago, but it's pain directly on the bone on the inside of your elbow. Okay, so for me, that is right there on the inside of my elbow. It's pretty focal when you have little league elbow, essentially. Some people can get soreness in their forearm muscles, more out here or in their biceps right here. But for this specific injury, it is directly over the bone. And so that's really what we're looking for from a diagnostic standpoint of just like location of symptoms. And so it's directly over the bone. A lot of athletes will have difficulty with just extending their elbow all the way. Could be flexing as well, but that you could have just loss of motion, but you'll have some discomfort with fully extending your elbow. Many times athletes will actually see a drop in velocity or difficulty with controlling their pitches or just their overall throwing performance for that matter. But really, these are almost like warning signs that your body is telling you prior to maybe even you actually experiencing discomfort, but you're going to notice that these things start to drop. And like I said, these are more just warning signs that your body is saying, hey, you may want to be check something out, if you start to have pain. A lot of times people will just have soreness after throwing, or just you can't recover as well as you used to potentially. A lot of it's a gradual onset. It's there's not a specific like number of weeks or months that this is kind of like this gradual onset, but I feel like most of the people I talk with, it's like, you threw last week and you felt a little bit of it, and then you took a break and just kind of iced it or whatever. And then, a few days later, you might have a bullpen and you're like, it still kind of bothers me. And then it just kind of keeps progressing a little bit, right? And so there's kind of this just gradual onset of these symptoms in that specific area. You could feel like you lose strength in your mobility, like I said, or you just don't recover as fast compared to when it was not hurting. Right. So let's talk about like what causes it. I kind of alluded to this earlier, but really, since it's an overuse injury, it's from throwing year round, and baseball has become a year round sport. Personally, I don't think it should be. I'm all for athletes playing multiple sports throughout the year, but you know, nonetheless, baseball has become a year round sport. You're playing in the spring, you're playing in the summer, and then you're bringing in the fall, and then you'll just continue the cycle over and over year after year. Another big thing that is a no-no when it comes to baseball and just like arm health is pitching and catching the same game. Okay, so we're not going to dive into like too much of the specific research when it comes to this, but just know there's quite a bit of research to back up pitch counts, pitching and catching the same game, and saying like, hey, these are things that you just don't do because it's essentially double the amount of throwing that you're doing in one game if you're pitching and catching, because the catcher obviously has to throw it back to the pitcher. Um, if you're not doing any recovery work or arm care after pitching, then you're just not doing the things that are necessary to get your body right and to really you know get your body back to baseline. After you throw, you're going to lose strength in your shoulder, forearm muscles. It's very documented, very researched that your strength actually will decrease. So will your tightness. And certain muscles will get tight. And so, you've got to do things to take care of your body and get your body back to baseline. Another huge one is not following pitch counts. Within the baseball world now, there's certain organizations that will go by innings pitched instead of pitch counts. And, it's not a good way to go off of innings because, you could have one inning where you throw 40 pitches and then the next inning you throw 10. And so for that day, you've thrown like 50 total, but you've only thrown 2 innings, right? And so by some organizations' standards, and they say, hey, because you pitched only this amount of innings, you can come back the next day and you'll be perfectly fine. That's not how it should be, guys. We have to follow pitch counts. You have to listen to your body and really get an understanding of how you respond to the stress you're putting on your body when it comes to throwing. And so there's some different guidelines when it comes to pitch counts. I will admit nothing is perfect, and you just have to listen to your body. You have to figure out what works best for you, and that's something we can talk about if you're interested in having those conversations, of course. But when you're talking about pitch counts, it's not just the amount of pitches that you're throwing in game, right? You have to consider the totality of how much stress you're putting on your arms. So, of course, when you warm up before the game, you're going to be playing catch play with your partner, however many minutes or how many throws you do with that, right? Let's just say it takes you 25, 30, 35 throws to get warmed up. Say you're going to pitch for that. You're going to start that game specifically. So you get warmed up. That's a certain volume of throws. And then of course, you're going to start to almost do like a mini bullpen to kind of get ready, make sure your stuff is on for the day. And so you're going to have that before the game actually starts. You're going to go out there on the mound, throw a few warm-up pitches to kind of get ramped up, and then you've actually got your inning where you're actually, throwing and actually doing the thing when you're playing and pitching. And so there's a lot of stuff beforehand that actually occurs when it comes to throwing volume that precedes actually like playing the game, right? And then it kind of continues on. So you throw, you pitch an inning, and then you guys go to hit, you go back on the mound, and you're going to throw however many warm-up pitches again to get ramped back up. And so you have to consider the totality of volume of throwing, and it's not just when you're pitching in a game, right? So just kind of some food for thought. Just kind of think about that. Another huge thing that we obviously have to talk about is poor throwing mechanics. That can lead to increased stress on your elbow, right? I've seen some wonky throwing mechanics, and I've seen some people really educate well on throwing mechanics, and I've seen people educate really poorly on throwing mechanics. And so there are certain positions that we can get our bodies in that are the most efficient when it comes to good mechanics. And, we're not going to dive into all of that kind of stuff today. But again, those are conversations that we can have, or if you want to do evaluation, we can dive into all of that kind of stuff. But, when it comes to being an efficient thrower and throwing hard and throwing safe, there's some very key specific things that athletes tend to do to get their arm in at certain angles. And the people that do that stuff typically have good quote unquote throw mechanics. They're very efficient. When I talk about good throw mechanics, I'm primarily thinking in my head around efficiency. How do I move my body in an efficient manner to be able to throw or get the outcome I'm looking for at the right velocity, right intensity, control, all those things. So like those outcomes that we're looking at. But how do I do that in an efficient way where it reduces the stress on my body? That's what we really need to be thinking and talking about. So, right, when it comes to throwing mechanics, though, there are specific places in the times during the throwing motion that place increased stress on your elbow and elbow and shoulder and just different parts of your body and things like that. But this is essentially what I want to make sure that you really understand, that certain parts of the throwing motion are going to increase certain stress on your body, right? If you're having discomfort or pain and you go to somebody and they're like, well, it could be this or it could be that, and they're really not evaluating your throwing mechanics, and they're not identifying, hey, or they're even asking what part of the throwing motion is it bothering you in, right? It's very logical, right? And so if that's not a question or conversation being had with the provider that you're seeing, or even like your coach, then you just know that, hey, we need to take a deeper dive into what part of the throwing motion is causing stress on these structures. And so when it comes to little league elbow specifically for the growth plate, there is primarily one area that is going to put the most stress on your elbow. And this is a kinematic sequence type of like image, if you will, kind of like breaking the different phases of throwing. And it's really right here, right? This late cocking max external rotation, ER means external rotation. And so that is what we typically see, people in a game. It kind of looks like their shoulders are just like way back, right? Um, that's this position specifically. And this is where we get a ton of stress on the elbow, a ton of stress on the shoulder as well. But we're talking about elbow specifically. And so that's what we're going to be talking about right here. So max external rotation in this late cocking phase. So this picture right here, we're getting a ton of stress on the elbow right here. There's a ton of just stress going back into external rotation. It's putting a lot of valgus force on the elbow. And I mean, I feel like it's kind of obvious, like just looking at this picture, like it looks like he's putting his body in a very stressful position. Am I wrong? Probably not. So just think about this position right here. If you're athlete, or this is where you feel it when you throw and you're having pain directly on the bone, it might cue you into thinking, be like, hey, this might be potentially like a growth plate thing. So you have to be officially evaluated by a medical professional. This is not a diagnosis, obviously, but I just want to educate and make sure you guys are aware that this is the stuff when you might feel it. All right. So big question, of course, is like, what do we do about it, right? Now, I don't like to be the bearer of bad news, but it would be negligent of me to tell people that they can just go play, right? Like that you can just go do whatever you want to, just ignore the pain, ignore the symptoms. But when it comes to growth plate injuries, it's a stress reaction to the bone, and so the bone is actually getting irritated. So the real recommendation of this kind of stuff is no throwing for about 12 weeks. And I know that can be a big blow for a lot of athletes, because like, wow, 12 weeks is a long time, 3 months out of the year. But when it comes to stuff, this is serious. Like we have to make sure that we're taking time off from throwing to reduce the stress that you're imparting onto your arm. So, you can go to there. Different providers will say different amount of times, but regardless, whether it's like 8 weeks, 10, 12, you just have to know you have to take time off from throwing. But the general recommendation is about 12 weeks of no throwing. You've got to get an actual evaluation from an orthopedic physician, or I say and a physical therapist that specializes specifically working with baseball players. I can't stress that enough. There is a huge difference in a generalist practitioner in physical therapy versus somebody that specifically works with baseball players. And in school we're not taught this stuff, right? We're really not taught throwing biomechanics. It's just, there's so much to learn in physical therapy school. There's so much to learn in medical school that, when it gets to these very niche populations of working with certain people, that sometimes you just can't get that in school. And so you want to make sure that you're seeing somebody that actually specializes with baseball players. When it comes to growth plate injuries, really have to get some sort of imaging probably to officially diagnose it. So x-rays are typically the first line of imaging that is going to be performed. I think I showed, that picture earlier of the growth plate there on the inside of the elbow. So that was an x-ray. Possibly MRIs are needed if, we need to look at some other structures, when we're talking about like ligaments, tendons, muscles, different soft tissues, nerves, things like that, to see if something else may be affected. But in general, x-rays are pretty much the first line of imaging that people will get. So a big thing that I want to really emphasize too is, when we talk about what do we do about this to actually go from, having pain to actually performing at a high level, like how do we bridge this gap, right? We'll take time off from throwing the 12 weeks, but a lot of times if you go to, again, like a generalist physician, at the 12-week mark, they might be like, okay, you're good to go, right? Just continue to get back into throwing, gradually ease back into it. Might give you a piece of paper with some sort of return to throwing program that's, 30 years old. So it's really outdated. But the reality is that we have to address some very specific physical um, things that you might have in order to get your body right and ready to actually start a throwing program, right? So you have to do some sort of strength training, probably mobility work somewhere, and you have to go through a full plyometric program where we're ramping up your body to move fast, and so you can take on the demands of throwing, right? Throwing is one of the most stressful activities of all sports, and you have to make sure that your body's ready to actually take on the demands of throwing. And one of the ways that we do that is that I require athletes to pass a battery of return to throwing tests, if you will. And so there's a ton of stuff to this. We're not going to go through all of it today, but just know that you have to get your strength back. You have to have good mobility. You have to be able to move fast and safely, and you have to pass testing in order to start a return to throwing program if I'm working with you. And then from there, we actually dive into a custom structured return to throwing program. Like I said earlier, sometimes you'll get a very basic just piece of paper that was a throwing program for like 20, 30 years ago. There's been so much advancements in throwing programs that we have to, and technology that we have to, use advanced technology to raise the standard of, if you will, on throwing programs. And so there's different ways we can quantify how much stress you're putting on your arm. But just know there should be a very good structured plan going forward to get you back on the mound. And that's what every athlete needs that has little league elbow. But I would honestly transparently say that probably 95 to 99% of people that do have this probably aren't getting the exact kind of sequence of events that you should be doing in order to get back to full performance and above that, higher than when you were pre-injury. Okay. So let's talk about this really, really quick. Because I always love highlighting this when I talk with parents and athletes and coaches. So it's hard to see, but this is an arm right here, right? This right here is the inside of the arm. So we're talking about the inside of the elbow. All of these muscles right here, this is what this is right here. So I'm not going to go through the muscles, but all of these muscles really attach on this medial epicondyle where the bone is getting irritated. Okay. Now, deep to this, where this black line is, this is where your UCL is. Okay. Now, in younger athletes, the stress from throwing when you get into this max externally rotated position, it's primarily going to be put on the growth plate first because that's the most vulnerable aspect that takes a lot of the torque and tension there. Once the growth plate closes, though, then the force is imparted to the UCL primarily. So that's why we don't typically see UCL injuries. People that would have Tommy John, if you will. We don't really see that in younger athletes that are 10, 11, 12 years old because the growth plate's still wide open. It's taking most of the force first. And once that growth plate closes, that's when people start to have UCL type injuries. So I say all to say all of these muscles right here attach directly on the bone. And they're directly over the top of the UCL. Now, This is why strength training for your forearm, along with your shoulder, everything up top too, but forearm right here specifically is so important for baseball players. The stronger your forearm muscles are right here, it takes on the stress and it doesn't allow it to get to the growth plate in the UCL essentially. So we have to be doing forearm work. We have to have, big, massive forearms. You see the guys that play baseball for a long time, guys that have play baseball have massive forearms. And there's a reason for that. We have to be able to build this stuff up in order to safely um, protect these areas. Okay. All right. So let's talk about how can I stay healthy long term. Now, I mentioned earlier that there are some different guidelines when it comes to pitch counts. So Pitch Smart um, has some pretty good guidelines. It's a good starting point. I will say there's a lot of research to actually say that people don't actually follow this. It's not that it doesn't work or it's not, flawed, but it's just people just don't do it, right? It's a guideline and people just kind of gloss over it and just kind of ignore it. But nonetheless, it's a good place to start, right? If you don't have anything at all, it's a good place to start. Another thing that you have to make sure that you're doing is proper warm-ups. That's another area that athletes typically would just gloss over before games is you're not doing a proper warm-up to actually get your body ready to take on the demands of the game. Arm activation drills or pre-throw activation, if you will, doing band work, some sort of arm care before you throw to make sure your arm is ready to take on the demands of throwing again. Arm care and strength training, of course, is going to be staples. What's not here is, but mobility drills, recovery. We have to do things after we throw within 24 to 48 hours to get our bodies back to baseline to make sure that we're staying healthy. So improving throwing mechanics, and I want to highlight this doesn't mean just more pitching lessons. All right. So pitching lessons are fantastic. I work with a ton of pitching coaches, but a lot of that is very outcome oriented, right? I want to work on this stuff beforehand. I want to work on the actual mechanics before the ball is even released from your hand. What does all of that stuff look like? And so that's what I'm talking about when we're improving your efficiency and your throwing mechanics. That's the kind of stuff that we need to be working on as well, in combination with actually doing pitching lessons, of course. There's a ton of different drills you can do, weighted ball drills, and things like that to get your arm and your body in the right positions to really groove those movement patterns really well. Playing other sports to give your arm a break from throwing, right? I love it. I said this earlier. I love it when I have athletes that play multiple sports. And actually, there's good research that they've done in MLB players specifically that the players in the MLB that played multiple sports in high school got injured less often than those that specialize in just baseball. It's a very, very interesting research study and really highlights the importance of making sure that you're giving your arm a break and stressing your body in other ways, like through other sports, in a very healthy way as well. So, what is one of the last things I would say is working with a baseball physical therapist that understands your unique needs and can prescribe the right exercises exactly for where you're at what age you're at the right time of the year, right part of the season. You've got to be able to understand your body. And I really don't think that people are fully going to be able to understand their body without having a little bit of help and guidance. So you have to invest in yourself, invest in your body to be able to understand the things that you uniquely need in order to keep yourself healthy and safe while you're throwing. Right. So let's recap. Little league shoulder is an overuse injury, right? It's most likely, and I personally believe you can't prevent all injuries, but this is something that a lot of times, if you're doing the right things in place beforehand, you can significantly reduce the risk of this for sure. You've got to recognize the symptoms early on, get evaluated ASAP. Guys, don't wait for this. The more you throw with it hurting, the more likely that it can, progress and just get worse. You've got to rest. You've got to rehab. You've got to get on a structured return to throwing program. That's absolutely crucial, like we talked about. And for long term, guys, you got to be doing arm care. You've got to be doing your recovery work. You've got to be doing real strength training, which is actually different than arm care, right? You've got to be doing things to get your body physically stronger to take on the demands of the game. And of course, I would talk about improving your overall throwing mechanics. So, yeah, I think that is everything that I want to talk about for Little League Elbow specifically. If you have any questions, feel free to reach out. I would love to talk about this stuff with you guys more and just make sure that any questions that you guys have, I can answer them. If I don't have the answers for them, I can find out the answers for you. I can promise you that. So hope you enjoyed this, and just let me know if you guys have any questions. Thanks.